Our top story, and Kenya is today joining the rest of the world in observing World AIDS Day. The theme of World AIDS Day 2021 is quote-unquote "End Inequalities and AIDS", with a special focus on reaching people left behind. World Health Organization and its partners are highlighting the growing inequalities in access to essential HIV services. HIV remains a major public health issue that affects millions of people worldwide. Although the world has made significant progress in recent decades, important global targets for 2020 were not met. Division, disparity, and disregard for human rights are among the failures that allowed HIV to become and remain a global health crisis. Now, COVID-19 is exacerbating inequities and disruptions to services, making the lives of many people living with HIV even more challenging. Indeed, and staying with that story, I'm joined by my colleague, health and science reporter, that is Saada Hassan, who joins us with a brief on the perspectives about this day. Good afternoon, Saada. It's good to speak to you. So much is happening today in terms of the World AIDS Day. But as a country, where are we in trying to manage this global problem?
Thank you so much, Maringa. And indeed, as a country, right now we have an approximate of 1.5 million Kenyans who are living with HIV and AIDS. Increasingly, the number of teenage and young adult population of those who have HIV and AIDS has increased over time, and this is a concern for us as a country, and also maybe in particular counties that have a higher number, because this means that there is a gap that we are not reaching in terms of the measures that are in place that have been put by the Ministry of Health and the government in general. And this means that we need to go back to address the issues that are arising from these young people. It means that we need to reach to their voices to know what measures we should put in place so that we can be able to address this rising pandemic. Over time, we've seen also lack of key important things like condoms, like testing kits. You find that a mother can go to a health facility and she's pregnant and maybe she's about to deliver, and she's not tested for HIV and AIDS. This poses a huge risk to the baby and also to the mother. And this is just some of the key factors that are affecting us as a country in terms of managing HIV and AIDS. And also poverty is a key factor that is affecting many young children, many young girls and boys. And this is some of the factors that we need to address as a country if we are to move forward in managing this disease.
Indeed, Saada, just briefly as we wind up this conversation before we cross over to Nakuru, it's been 40 years since the AIDS was, highlighted and as a global issue, as a global problem. Why do you think? Because what do you think? Because so many people have said because the COVID-19 pandemic just came in last year and you already have vaccines, HIV appears to have been left out.
According to scientists or according to pharma, most of the time when something is affecting a huge number of people, then so many people come in to invest in it, and that is why maybe we have vaccines, because many people saw that this is a global pandemic and we all came to invest in it. It is the same thing with HIV and AIDS, but maybe it's proving to be more hard to come up with a vaccine on it, and that is why we still need so much to be done to handle this. But so far we can see that the numbers have really reduced. You can't compare right now to maybe the years of 1990 or 1980, whereby the prevalence is about 12 to 13, 15. But right now we are about 4.7, which means the numbers have gone down. But then at the same time, the numbers are not going down as much faster as we would want. So this is why we have a need to ensure that we put in place policies and strategies that can work for all of us and not just for a particular audience.
And Saada, there has been quite a perennial problem, because earlier on you mentioned protection, especially for those to prevent HIV, and condoms have been quite an issue, because even just this week we did see sex workers in various parts of the country complaining of shortage. So what risk does this leave, especially the population in places that are considered HIV high risk?
All right. So when we talk about sex workers, these are people who interact with other people. And, maybe one can be HIV positive. And when they happen to, have intercourse without protection, it means you're posing a huge risk to the person that you're interacting with, whether they are HIV negative or, positive. So at the end of the day, if this person goes back to their family and has intercourse, maybe with the wife or the husband, they're posing another huge risk to the other partner. And at the same time, this grows the huge number of people living with HIV carry into our country. So this goes back to us as, you know, as the stakeholders. What are we doing? What are we investing? How much are we investing in these resources, in these facilities? Because even us as we're reporting, the data is not very up to date. It is not standard. You know, we can't really reach out to every key person in the society, because at the end of the day, it is about me. Have I gone to be tested? Have you gone to be tested yourself? So it all goes back to us as individuals, and then it also goes back to the ministry. What measures are they putting in place? What laws, policies are there to ensure that all these iniquities, inequalities are done away with, to create safer spaces for young people who are living with HIV and AIDS, or even just the general population, so that they can be able to, you know, go out and get tested, and also, you know, find solutions on how to engage with people who are living with HIV and AIDS.
Sada Hassan, Health and Science reporter here at the Standard Group PLC. Thank you so much for joining us on News Desk. Now, staying with that story, I want to take you to Nakuru, where the celebrations of the World AIDS Day are being marked today.